Okay, so labor pain. It's a big one.
Yeah, it's definitely a topic that brings up a lot of, questions and maybe some anxiety for
For
people.
sure. I mean, it's one of those things everyone's heard about
Right.
and maybe has some strong opinions about. But today, we're going to dive deep into this whole topic
Absolutely.
of labor pain. We're using this awesome nursing textbook chapter
Yes, by Lori B. Kaufman.
all about managing that pain. So we're
Ugh.
going to break it down, look at what causes the pain,
Mm-hmm.
what makes it better or worse, and then all the ways you can manage it.
That's right. All the way from, those non-drug options to medication and everything in between.
Exactly.
Mm-hmm.
So to kind of kick things off, I think it's important to remember that labor pain, it's not just like one big ache.
Right. No, it's not just like one constant thing. It actually changes throughout the whole process.
It totally does. So in those early stages, what are we mainly dealing with?
So early on, it's mainly what we call visceral pain.
Visceral
And that comes from a bunch of different things happening inside, as you can probably guess from the name.
inside, yeah.
It's from your cervix changing, the lower part of your uterus stretching, sometimes even if your uterus isn't getting enough blood flow. And you usually feel it sort of deep in your lower abdomen, like a deep ache.
Okay, so that's that early labor pain.
Yeah.
And then things kind of shift, right?
Yeah,
Yeah.
definitely. As labor
As you
progresses,
get further along.
yeah, you move into what we call somatic pain.
Somatic.
And that one's a little different in how it feels. It's caused by, the pressure and the stretching of your pelvic floor and your perineum as the baby is, moving down.
Okay, so more like a pressure pushing down sensation.
Exactly. And it's usually felt like lower down.
Yeah.
People often describe it as like sharper, more intense, a burning kind of pain.
Wow. Okay, so two different types of pain at different points.
Yeah.
That's helpful to know. But one thing that I thought was like so fascinating from the textbook was this idea that everybody's pain threshold is pretty much the same.
I know. It's kind of wild, right?
It's so wild.
Yeah.
So the point where you actually feel the pain.
Yeah, the point where the signal actually registers as ouch in your brain, that's pretty similar from person to person.
That's crazy. So it's not that some people are just tougher,
Right.
it's how they're interpreting it.
Yeah, it's more about how our brains perceive that signal
Right.
and then also how much we're willing to put up with, basically.
Okay, so that's pain tolerance.
Exactly. Pain tolerance. Like, how much can you handle before you're like, okay, I need something to change?
I need help.
Yeah, exactly.
Got it. So you could have the same like pain signal coming in,
Mm-hmm.
but then your brain's like, it's fine. Or your brain's like, this is the worst thing ever.
Exactly. And, a lot of things can influence that perception.
Like what?
Well, think about like cultural background.
Oh, yeah.
Some cultures are, very expressive with pain. Others, it's more like, keep it to yourself.
Keep it in.
And that can definitely affect how people approach, pain management during labor.
And then past experiences too, right?
Oh, huge. If
Yeah.
you've had, a really rough time with pain before, maybe you're going to be more anxious going into labor. Or on the flip side, maybe you had a great experience with pain management. You're like, bring it on.
Totally.
Yeah.
And what about just your general mood? Like if you're already stressed,
Oh, yeah. Anxiety,
does that make it worse?
big time. When we're anxious, our bodies just crank up the volume on those pain signals.
Wow, that's crazy. So managing your anxiety is key.
Huge for both your mental state and how you actually experience the physical sensations.
This is all reminding me of that gate control theory that we talked
Ooh,
about.
yeah.
Can you explain that again? I feel like it's relevant here.
Okay, so gate control theory. It's basically this idea that non-painful input can kind of close the gate on painful input. So, like, if you can flood your system with, positive sensations, it can
Yeah.
help to drown out the pain signals.
Oh, so it's not about like blocking the pain. It's more about,
It's about creating a different experience, yeah.
okay.
And that's where things like relaxation techniques and, imagery, all that can really help.
So kind of creating a sensory world that feels good.
Exactly. Prioritizing comfort and relaxation.
Okay, I'm into it.
Okay, so we've talked about all the amazing things you can do without medication.
Right, all those natural pain management techniques.
But, sometimes you need a little extra help.
Yeah, for sure. And I think there can be like a little bit of a stigma around using medication during labor.
Oh, absolutely.
Like you're somehow not strong enough or you're giving in.
Yeah, that's definitely not the case. It's all about having options
Yeah.
and finding what helps you feel, most comfortable and most in control.
Exactly. So let's talk about those options.
Okay.
The pain relief medication. What are the main categories?
Well, a big one is something called systemic analgesia.
Systemic analgesia.
Like,
Okay, break that down for me.
so basically, it means the medication goes into your bloodstream
Okay.
and it affects like your whole body.
Whole body. Okay.
And a common type of systemic analgesia is opioids.
Right, opioids.
You might also hear them called narcotics.
Yeah, I've heard that.
And those are powerful pain relievers. They can be given, in your IV or as like an injection.
Okay. And they're really good at like taking the edge off the pain.
Yeah, they can be very effective.
But are there side effects? I feel like that's the thing people worry about.
Yeah, there are definitely things to consider. Opioids can cause drowsiness,
Okay.
and that can affect both the mother and the baby.
Hmm.
And they can also sometimes slow down the baby's breathing.
Oh, okay. So there are like risks and benefits to weigh.
Right, exactly. And
Hmm.
healthcare providers always think about that really carefully.
Okay, that makes sense. So that's systemic opioids. What else is there?
So another category is what we call nerve block, analgesia, and anesthesia.
Nerve block. Ooh, that sounds intense.
It's not as scary as it sounds.
Okay, good.
Basically, it's using local anesthetics. So numbing medicine, basically, that's injected to kind of numb specific nerves.
Okay.
So it blocks those pain signals from traveling to your brain.
So it's like really targeted.
Yeah, exactly.
Okay, and what's an example of that?
So one example would be a pudendal block,
Pudendal.
which numbs the nerves around like the vagina and the perineum.
Okay, so that would be helpful for like the pushing stage.
Yeah, exactly. And also for any repairs that might be needed after birth.
Stitches and all
Yeah,
that.
yeah.
And then, of course, the big one that everyone's heard of, epidurals.
Yep, epidurals, very popular.
Super common. So can you remind me how those work?
Yeah, so an epidural, it's a type of regional anesthesia, which basically means it numbs a larger area.
Okay.
So they use this tiny little tube, it's called a catheter, and they place it in your back in a space called the epidural space,
Okay.
which is around your spinal cord.
Got it.
And that catheter delivers medication continuously to block those pain signals that are coming from your uterus, your birth canal.
So it's like ongoing pain relief.
Yep, continuous.
Okay. And I've heard like some people say they can still feel pressure with an epidural, but not pain.
Yeah, that's pretty common. So the goal isn't necessarily to numb everything completely.
Okay.
It's to take the edge off the pain.
Huh.
But you might still feel pressure, especially as the baby's, moving down.
Okay.
And you can actually adjust the dose of the medication to find that sweet spot.
No, okay, interesting. So it's not just like an on-off switch.
Right.
You can kind of fine-tune it.
Yeah.
Okay, that's good to know. And I know a lot of people like have questions about the safety of epidurals.
Hmm.
Are there risks involved?
So yeah, like any medical procedure, there are potential risks, but epidurals are actually considered very safe when they're done by, experienced professionals.
Okay.
And your doctor or midwife will talk to you about like all the specific risks and benefits.
So you can make an informed decision. Okay. Now, what about spinal anesthesia?
Okay, so sometimes called a spinal block.
Spinal block. Got it.
It's a little bit different. Instead of putting the medication in the epidural space, they actually inject it directly into your spinal fluid.
Oh, wow. Okay, so is that like faster acting?
It is. It works super quickly, usually within minutes, but it doesn't last as long as an epidural.
Oh, okay. Interesting.
So spinals are often used for C-sections,
Okay.
but they can also be used for vaginal births, especially if you need pain relief really quickly.
Got it. And then there's this other thing I've heard of, combined spinal epidural.
Oh, yeah.
What's that all about?
So that's kind of a cool technique. It's like the best of both worlds. You get that fast relief of a spinal
Right.
and then the ongoing continuous relief of the epidural.
Oh, so you get like the quick hit
Yeah,
and then the long-lasting support.
exactly.
Okay. Now, switching gears a bit, I want to talk about nitrous oxide, laughing gas. I have to admit, when I first heard about this option for labor, I was like, wait, is this a comedy show?
I know, right?
But seriously, laughing gas during labor.
So it is the same gas that's used at the dentist,
Okay.
but during labor, they use it in a much lower concentration.
Oh, okay, that makes sense. So you're not like cracking jokes during contractions.
No stand-up routine. Okay,
I-
good. It's more about like reducing anxiety and taking the edge off the pain.
Okay.
Some people say it makes them feel a little, euphoric,
Mm.
relaxed, and it can make those contractions feel more manageable.
That sounds nice.
Yeah.
And it's self-administered, right?
Yeah. That's one of the nice things about it. So you have control over like when and how much you use. You just breathe it in through a mask or a mouthpiece.
Oh, that's cool.
Yeah.
So you can like adjust it as needed.
Yeah.
Yeah.
It's a good option for people who like want some pain relief but still want to be really present and alert.
Okay, I like that. Okay, so we've talked about opioids, nerve blocks, epidurals, spinals, nitrous oxide. Is there anything else?
Well, there's also general anesthesia,
Right, general anesthesia.
but that's only used in very, very specific situations, like emergency C-sections, for example.
Okay, so for most vaginal births, general anesthesia is not part of the plan.
Exactly.
Got it. Now, before we move on, are there like certain situations where some of these options aren't recommended?
Yeah, there are definitely some medical conditions or situations where, an epidural or other interventions might not be the best choice. So, for instance, if someone has a bleeding disorder
Okay.
or really low blood pressure
Mm-hmm.
or an infection at the, potential injection site,
Makes sense.
those would all be like reasons to maybe consider a different option.
Got it. And I know there's been some talk about epidurals in people who are obese.
Yeah, so placing an epidural can be more challenging in people who are obese just because like anatomical differences.
Makes sense.
It's not impossible. But it's something that, needs to be discussed with the healthcare provider.
Okay, so basically, good communication with your care team is super important.
Absolutely. Being really upfront about your medical history, any concerns you have, and what you're hoping for in terms of pain relief.
Right. So it's a team effort to find the best approach.
Exactly. And, even if you have a plan going into labor, it's okay to change your mind as things progress.
Yeah, sometimes you need to adjust.
Totally. Your needs might change, your preferences might change, and that's totally normal.
I love that. Flexibility is key. Okay, so we've talked about all these different types of pain relief.
Lots of options.
It's a lot to take in.
It is.
But I think the main takeaway for me is that there's no like right or wrong answer.
Absolutely. There's no one-size-fits-all approach. Every birth is different.
Right.
Every person has a different pain tolerance, different preferences, different priorities.
Okay, so I guess before we wrap up, the big question is, how do you figure out what's right for you?
Right. So I think the most important thing is education.
Okay.
Talking to your healthcare provider, asking questions, really exploring all the options.
So you feel empowered to make a decision.
Exactly.
Okay, that makes sense.
And, don't be afraid to advocate for yourself.
Yeah, speak up.
Yeah, if you have strong feelings about something.
Okay, great advice. Now, we've talked about all the options, but I think it's important to address the safety piece. So when we talk about safety, especially with medication, what are the big things to keep in mind?
Well, I think the most important thing, honestly, is informed consent.
Okay, yeah. So you know what you're getting into.
Exactly. Like
Yeah.
you have the right to understand, you know, all the potential risks, all the potential benefits.
Of anything they're doing.
Yeah, before you agree to it.
It's your body, it's your choice, right?
Exactly.
Okay, so ask questions.
Absolutely.
Don't be afraid to like really clarify things.
Yep.
And I imagine timing is a factor too, right?
Oh, yeah, for sure. Timing is super important. Like different pain relief options have different kind of windows of opportunity.
Right. You can't just be like, okay, I want an epidural now. And they're like, well, the baby's crowning.
Right, exactly. So healthcare providers are always thinking about, where you are in the labor process.
Okay, so it's always a judgment call based on what's happening.
Yeah. And then, of course, once you have any kind of medication, monitoring is key.
Okay, so what does that look like practically?
So they'll be watching your vital signs really closely.
Like blood pressure, heart rate,
Yeah, all of that.
making sure you're stable.
Exactly. And they'll also be watching the baby's heart rate.
Okay, so keeping an eye on both of you.
Yep, making sure everybody's doing okay.
And this is where, like, a good support team is so important.
Absolutely. Nurses, doctor, midwife, doula, birth partner,
Yeah, your whole crew.
everybody working together.
Communicate,
Yeah.
communicate,
Yeah.
communicate.
Yes.
So, even if you're feeling like a little out of it, don't be afraid to speak up.
Exactly.
If something feels wrong or you're having second thoughts, say something.
This is your experience.
Yeah,
You deserve to feel supported and, heard.
I love that. Okay, so we've covered so much ground today. We've talked about the science of pain,
Yeah.
all those amazing natural techniques,
Mm-hmm.
and then, of course, the medication options.
Plus safety.
Safety first. And I think, if there's one big takeaway, it's that there's no one right way to do this.
Right. There's no magic formula.
Everybody's different.
Everybody's different. And, what works for one person might not work for another.
So as we wrap up, I
Mm.
kind of want to leave our listeners with a question.
Okay.
Thinking about everything we've talked about today, what are your priorities for your birth experience?
Yeah. What matters most to you?
What kind of experience do you want to have? What level of control do you want to feel?
Mm-hmm.
And what feels right for you in terms of pain relief?
Talk it over with your partner, with your healthcare provider, and come up with a plan that feels, really good, really empowering for you.
We're so excited for all of you who are about to embark on this journey,
Yes.
and we're wishing you a safe, healthy, and empowering birth experience.
It's been so fun talking about all of this with you.
Absolutely. And remember, knowledge is power. The more you know.
The better prepared you'll be.
Keep learning, keep exploring, and we'll see you next time for another deep dive.